Hey, have you ever wondered when you've gone to buy a first aid kit, is this the kit that I need? A lot of factors go into what kit you need, depending on if you're hiking, boating, camping, canoeing versus a motorboat. I'm going to go over some of that today, and I'm going to review a kit that I just picked up. And we'll go through that, and I'll show you some of the things that I look for when I'm buying a kit. I'm going to start doing these reviews on a lot of different kits that I have, and we'll go over more and more kits that I'm going to buy and review as well and tell you the good and the bad. My name's Mark. I'm a physician assistant. I was a paramedic firefighter for 17 years. I've been around first aid kits all my life. I'm an outdoors kind of guy, and that's why I've developed this channel called Living the Journey. Because life is not about a dream, it's about a journey. We all go through different journeys throughout our life. So let's get into it. This is a Ever-Ready Industries Trauma First Aid Kit. In fact, I pulled up their title. I got it here on my phone. It's on Amazon, and it's called Ever-Ready Industries Outdoor Adventure First Aid and Survival Kit with Tools and Outdoor Protection. Exceed OSHA guidelines in ANSI 2009 standards, 211 pieces. It is listed right now, today. This is, what day is it today? It's July 13th, 2025. That's what happens when you're retired. You forget what day and date it is. And it sells for $119.95 currently on Amazon. So I looked up that ANSI 2009 standards that the title refers to. I don't know what that even means as it relates to first aid kits. And what I found when I Googled it, let me pull that up here. When I Googled it, it says the ANSI A117.1-2009 standard titled Accessible and Usable Buildings and Facilities. It was first published back in 1961 with the latest released in 2009. And so it didn't really, it looks like it's just geared towards facilities, buildings, and elements accessible to individuals with disabilities such as difficulty walking, blindness, deafness, and coordination issues. So I looked up a little bit further and I asked Google, does it have anything to do with first aid kits? And it says no, it is not directly related to the first aid kit requirements. Rather, it addresses accessibility standards for buildings and facilities. The standard that outlines first aid kit requirements is ANSI/ISEA Z 308.1, which specifies the contents and classifications for workplace first aid kits. So I don't know if that was just a misprint by the manufacturer, but their title you can see right here. It says exceed OSHA guidelines and ANSI 2009 standards. So it says that it has 240 pieces on the bag here. The listing says 211 pieces. So let's get into it. I picked this up, and I'm going to come right out front and tell you that if it is missing some pieces, I bought this at an Amazon bin store. The bag was open. You can see here it was ripped open, but the contents, I did unzip it and look to see if it had contents. I did not go through it. This will be the first time I've gone through it. And it had contents, so I picked it up. So let's zip it open. Well, let's look at the outside. So it has this on the outside, just tells you what it is, like you couldn't tell. It does have MOLLE. The standards as far as the sewing, you know, I guess it's okay. It does have some double thread here. The handle looks a little bit messed up, but that might be why it was returned to Amazon. I'm not really sure. Some loose threads here. I don't know what comes from something on the inside. Overall, I would say it's okay. It looks like it could be a nylon ripstop. It doesn't say that in the listing, at least as of today. Yeah, overall it looks okay. I wouldn't go throwing it around a lot, but okay, so this is how it looks when you first open it up. I like to evaluate things when you first open it up. Is these need to be the most critical things that you have in your bag. These are going to be things like if it's a trauma kit, a tourniquet, maybe an extra tourniquet, something to stop the bleeding, and airway. I don't see that. What is this here? Well, this is a tourniquet. It doesn't have a brand name on it. It looks like a cat, but I don't know if it's actually made by North American Rescue or if it's, well, it's made in China. Do what you will with that. So it did have a tourniquet right here in the middle. It does have some gauze pads. This looks like, let's just pull this out. It comes with, let me see, 5x9, 5x9. This is an iPad. Comes with 4 iPads. So just because they're iPads doesn't mean you can't use it other places. Just remember that. So this is 2 1/8 by 2 5/8 inches. Flipping this open here. Okay, so now you come to more of the pressure bandages. So this looks like a Israeli dressing or a emergency trauma bandage, trauma wound dressing, 4-inch. That's good to have. It does come with a miniature all-in-one first aid kit. I guess they give you that. It has some band-aids, butterfly closures, a couple little small 2x2 gauze, some cotton tip applicators. So it does have that. That's taped shut. A little CPR kit that would be needed in an emergency, which has vinyl gloves and maybe something to cover the mouth. Yeah, that's a mouth guard, little alcohol pad. And there's something else down in here that was right under the tourniquet. Oh, it's a smaller little tourniquet. Boy, and if you had to press it into a true tourniquet, like for trauma, this is more like what you would do when you give a blood draw. Could you use it? It'd be better than nothing, but you would want to use your big tourniquet for any kind of big trauma to stop the bleed. So let's get a little bit further into this. So now you've got to get the kit all the way open to get some of the other things. So here are your gloves that you would use. I guess, yeah, there's 2 that were in that little CPR pouch. So you could use those initially because they were right there on top. Here's an emergency blanket. So if you've seen those little silver blankets that you can use that can help control the heat to keep the patient warm if it's a cold environment. Has some little shears, little bandage shears. They're kind of small. I like the bigger ones, but it's hard to put them into a small pack. So I understand, at least you've got them. And then what's this? You got a pin underneath here. Okay, so this is just a regular, looks like a ballpoint pen. You know, trauma kits stay in the car or a boat or someplace. They usually don't stay in a controlled environment. You probably wouldn't be using this very often because it's probably going to dry up. Looks like you have a little first aid kit book, first aid manual. I guess if you needed that, but you don't have time for this in a true emergency, so you need to have some training. What else is down in here? This is a fever scan. I guess it gives you the temperature in Celsius and Fahrenheit. You got 3 of those. and then a bunch of little Band-Aids. I don't know how many are in there. They look like they're all, well, no, they looks like there's 2 different sizes in there. Probably about 20 or 25 of each, if I had to guess. Some alcohol pads. And you got 3 of those, 4 of those, no, 6 of those. Now, alcohol pads can dry up, so don't be relying on that if the kid has been sitting for a while. We went over that. What is this here? Looks like a wound seal, stops bleeding instantly. Okay, so what is this? It looks like it's a hydrophilic polymer. Yeah, so it looks like it's topical powder for minor external bleeding, easy to reach wounds. So this is, I guess it's going to be something like Celox or Quick Clot in the military world. So I would say that direct pressure is going to help you more than this probably would, but you could give it a try. Looks like you got some antibiotic ointments down here. This is first aid ointment, neomycin sulfate, polymyxin B sulfate. So this is like Neosporin, or very similar to Neosporin. I personally am not a fan of Neosporin. I worked in dermatology for 20 plus years, and I saw a lot of people react to Neosporin, an allergic reaction to Neosporin. In fact, back in, I think it was 2010, Neosporin was, or actually neomycin, not Neosporin, but neomycin, the ingredient, was the allergen of the year for North America. And when you think about it, where do you use it? You use it on open wounds, so it has direct access to the immune system. And, you know, people eventually, you know, have allergies. I've had many people that say, well, I've got Neosporin at home. Can I use that? And I go, absolutely, you can use it, but we recommend Polysporin. And I, believe it or not, many times I had the patient back 2 or 3 days later after surgery, and they're complaining of a rash, and it is a allergic reaction rash. We do a patch testing on them and find out that they are or had developed a neomycin allergy. So it's better than nothing. I'm not saying you're going to have an allergic reaction to it, but that's why I personally, in my kits, I like to use Polysporin. And then you have some skin cleaning wipes, it looks like. Let's see what these are. Antiseptic wipes. This looks like cleansing wipe. Okay, so just kind of cleanse the wound up a little bit if you're out camping and you don't have access to an emergency facility. You can at least clean it up a little bit and then bandage it up. It looks like it has a triangular bandage, so that's good. That can help with splinting. It actually has a couple of those. It does have a blood stopper, so it doesn't say what's in this. I don't see. It's made in China, but this could be something like Quick Clot, the manufacturer called Quick Clot. So it doesn't say that it has in there anything related to stopping the bleeding other than just maybe direct pressure, and it wraps it up. I would like to have a little bit more information on that, so if Ever Ready Company is watching this video, maybe they can chime in. Here's a roll of, it looks like just white tape. No markings on it to tell me how much is in there, but probably you know, enough for, you know, if you had to use this kit. Looks like you got some little roll gauze. That's good for holding bandages in place or dressings in place. Looks like you have 2 that are 2-inch and 2 that are 3-inch. And then ACE kind of bandage that is, again, a 3-inch bandage. And then over here, what do we have here? We have some wound closures, so it looks like 4 little maybe 5 little steri strips. That can be helpful if you're out hiking and you cut yourself with your knife or your hatchet, and you need stitches. You're 3 hours away or more. Like I like to camp. Sometimes I'm 6 or 8 hours away from help. And so, you know, you throw these on, it's going to act like stitches. That's where some of this would come in handy. You got to cleanse the area, make sure it's all clean, the skin, and then you pull it to get clean and dry, and then you put it on. And then further along, we've got some 4x4 gauze, 3x3, and some 2x2s. So you got, let's see what we've got here. 3x3, 2 of them. You've got 1, 2, 3, 4. Nope, I take that back. There's 1, 2, 3. Is there another one? Okay, so we've got 4 2x2s, 4 3x3s, and 1, 2, 3, 4 4x4s. And I think that's everything in the kit. We talked about that. We talked about the gloves. No, there's something. Oh, the SAM. This is the manufacturer that started this first was called SAM Company, SAM Splints. They are flexible aluminum splints, very helpful to splint things up. This is 18 inches, so that could get you a wrist and an elbow, could get you a lower leg if needed. And here's the trick. You can cut these to fit what you need it to fit. You can bend them to get what you need it to fit. A lot of people don't realize that you can cut them with these scissors here. Well, wherever they are. The scissors that came here, if you broke your finger or dislocated a finger, you can cut this off or cut it this way for long, you know, depending on how long you need, and put it over there and wrap it up, and you have a splint for your finger, which is splinting is hard to do for a finger out in the woods because you got to find little sticks. So this can work for that. So don't be afraid to use this if you need it to use it for a thumb or a finger, or even a toe. Although you can buddy tape your toe, you can buddy tape fingers. So overall, that does have a pair of tweezers in here. Let's see what else in case we're missing something else. Feels like something's back here, but it must just be a hard backing. Oh, no, there is something back here. How do you get to it? Oh, some more 4x4s. So 1, 2, 4x4 non-adherent pads. So the other were gauze pads. So these are the ones that have the protection on the side that goes up against the wound so it doesn't stick. So 2 4x4s, looks like 2 3x4s, 1, 2, 3, 4, 5, 6 2x2s. So missing anything else? There is a hard board back here. That's why, not a hard board, it's still bendable, but it probably feels like a little piece of plastic back there to give it some security or some strength here. So did we get everything? Nope. Here's another one. So looks like some little Q-tips and a cold compress that you would smack and get some cold. So yeah, now that's, well, I say that's everything, but is it everything? There is a opening right here, but there's nothing down in there. Yeah, so again, there's a little piece of plastic to give it some shape, the whole kit. So created a lot of mess here. It does have some safety pins here, which can be helpful. Don't forget that if you don't have a sling and you've hurt your arm, you can always pull your shirt up and wrap it up, and having safety pins, you could have somebody or you could do it yourself, tape, secure it to where it gives yourself a little bit of a sling-like action. So overall, this is not a bad kit. Some of the items are what I would call cheap, but do they work? They probably would. I'm not I'm more of a made in the USA kind of guy. However, I live in the real world, and the camera that I'm recording on, probably the bed or the futon that I'm sitting on came from China. Let's get real. If I can find things that are made in the USA, I will use them. Let's talk about the really emergency stuff that's in here, the stuff that you have to grab right away. I wish that was a little bit more accessible when you first unzip the pouch. Now, could you change it? Sure. Would I change it? Sure. These are nice to have the little tabs on it telling you where things are, but you need to know where things are. You need to go through your kit. You need to understand where it is, and you need to be able to use it in an emergency and not sit here and have to empty everything out. Having these is nice, but I would put all my emergency stuff, the stuff I got to get to right away, which is my airway, breathing, and circulation / hemorrhage stuff right here on top. Having the tourniquet, I'd set it down somewhere. Here it is. Having the tourniquet right here would be okay because I would know it's right here. Having maybe this Israeli bandage or this emergency trauma bandage, someplace I could get to it really quick, maybe stuck in right here, that would be good. It doesn't really have much airway stuff other than the things that you can put over the mouth of somebody to breathe in. But for a basic trauma kit, most people are not going to have oral pharyngeal airways or nasal pharyngeal airways or more advanced stuff. That's where learning how to do proper head tilts, when to do a proper head tilt, a mouth sweep, turning them on their side, whatever. That's where having a good first aid class. You can get first aid classes a lot of places. Stop the Bleed. You can Google that. They have classes that's more trauma related, but they're American Heart Association. You can learn the proper techniques for CPR, but having some good basic medical skills when you're out on your own, especially if you're out away, even if it's only an hour away from civilization, that's a long time to try to get somebody back that's having an emergency. So having something in your kit that you can help that person while it's taking you 30, 40 minutes to get back to an area where help can get to you, it is going to make your life a whole lot easier. Well, I hope you liked all this. I made quite a mess. I guess the next thing would be, would I buy it? I think it's a good kit. Is it a great kit? No. But is it worth $119, $120? I think that's a little steep if you could buy it on sale. Watch for it on sale. But it does have a lot of necessary stuff in it. It does give you peace of mind that you could take care of some minor injuries, even some hemorrhage, some massive hemorrhage, but you've got to be taught how to do that, or you have to have learned how to do that, because it's not just throwing on an Israeli dressing or a tourniquet. That helps, but there's other things that go along with it. So overall, I would give it a good score, not a great score, but certainly I've seen worse. I've seen a lot worse for about the same amount of money. So Everready, if you're watching this, I think you did good. I know I'm just one guy out of, several billion on this planet. But I've been around. I've laid hands on a lot of patients over my lifetime, and still do actually, occasionally. And this is a good kit. So I hope this helped. Subscribe to Living the Journey. I talk about a lot of different things, or will be talking about a lot of different things. I'm going to start doing more face-to-face videos. instead of the faceless stuff. I'll still have some of those, and we'll go over things together. If you'd like what you see, give me a like, subscribe, share it. And if you have a desire to have some other first aid related product reviewed, let me know. Sometimes I may just be able to message you and tell you that's a piece of junk, or don't spend your money on that. Here's a different product. But if I can get a hold of one and review it, I am not going to teach medicine on here because YouTube frowns on that. But we can go over and discuss things. And medicine classes, you need to find some first aid classes and get hands-on training, not just book smart. My book is a good place to start, but and I'll link to that in the comments section. But you really need to put hands on patients, because that's where you really learn it. You can read about it, you can see it done, but doing it yourself is a completely different thing, and do it more than once. Okay, well, I hope you all have a great day, and we'll see you next time. Have a good day.